you, Henry?
Hi, this is Deke Farrell with the Modesto Bee. We're out in Riverbank at the Teen Center where Representative Jeff Denham is meeting constituents in what they're calling like a coffee and casual conversation with Jeff Denham. As you can see outside here, there are a number of people protesting what they perceive as the congressman's flip-flop vote on the repeal and replace of the Affordable Care Act. They've got a liar, liar, pants on fire clothesline out here, and a flip-flop throne, along with some other signs that call for him to be repealed and replaced himself. We're going to go inside now. I haven't seen the congressman. He may have come in another door, and I think the event should be getting started shortly. There are activists out here with groups including Indivisible Manteca, among others, and they, as the congressman makes appearances here this morning, this evening in Turlock, and then at other stops in the area in the next day or so, they're calling it his Trail of Lies tour and planning to follow him along with this flip-flop throne and the clothesline of liar, liar, pants on fire. They're saying he flipped on his commitment to be a no vote on the American Health Care Act. They plan to ask Denham why he stated on the record that he would be a no vote and then abruptly changed his mind to a yes vote and was one of the deciding votes when Congress met. The LA Times reports that when the congressman was at the government night event in Denham on April 17th, he said he wouldn't support his party's health care legislation unless it left significant parts of Obamacare intact. They quote him as saying, "I've expressed to leadership that I'm a no on the health care until it's responsive to my community. There are things in the Affordable Care Act we expect to stay," Denham added, such as coverage for pre-existing conditions and expanded Medicaid coverage. So we're just going to hang here while we're waiting for the congressman to appear and start facing people. It looks like most of the signs of protest are remain outside at this point. No way of telling whether the folks inside here are just generally interested constituents or supporters or opponents, but I'm gathering that I'm going to guess that the folks inside here are largely just generally interested constituents, and the protesters, at least until the congressman gets here, will stay outside. They have indicated that once he is here, they do plan to come in and ask him questions as he's having his casual conversation here in Riverbank. For those of you just joining, this is Deke Farrell with the Modesto Bee. We're out at the Riverbank Teen Center where Representative Jeff Denham is having what they're calling coffee and casual conversation with constituents this morning. I'll roam outside again for those of you who missed it. There are a number of demonstrators outside holding signs calling for the repeal of Jeff Denham because he backed the repeal of the Affordable Care Act. Activist groups have brought what they're calling the flip-flop throne, representing his change of vote on it. The liar, liar, pants on fire clothesline out here with some burning pants, items hanging on clothesline that say "Killed ACA," Denham's Dirty Laundry, Defund Planned Parenthood, Loves Trump, No Town Hall, Shut Down the Government. Hi, good morning. I'm Deke Fair with the Modesto Bee. Sorry to be ambushing you. I'm doing Facebook Live. Wonder if you care to say what brought you out this morning?
Oh, absolutely. I'm here because of the Affordable Care Act and the fact that the Congress last week, the Republicans decided that they could pass a bill and basically remove health care for the people that Obamacare really came out for, and that's to help the people who can't afford health care. And they're trying to pass it off as an improvement when really they're turning over the whole thing to the states, and they're taking away pre-existing conditions and making it a choice by state, and they have to go through procedures to possibly get their pre-existing conditions. It's a very deceptive bill. I'm just disgusted with the Republicans. I don't think they really care whether people are going to get the kind of affordable, quality health care that they need. And bottom line, it's giving tax breaks to the wealthy. There's $889 billion of tax cuts going to the top people, and they're saying, well, we're going to give $8 billion more to the states to address the pre-existing portion of the bill. It's just unconscionable to me. So I'm here for this, and I'm also here because Congressman Denham said he was going to vote no, and he flip-flopped and voted yes. And he said that he was going to have a bill in Congress that would address keeping pre-existing conditions. That's what I heard him say. And then he completely went with the party line and lied to us, bottom line. So I'm just disgusted, and we need to get rid of him in 2018. He's got to go. He does not represent me or the people in our district.
Thank you very much for sharing your thoughts. It looks like they're getting started, so I'm going to go inside. Are you planning to go in and ask the congressman anything?
At the moment, I'm going to just stay out here with my sign, and then I'll probably go in, yeah.
Thanks again.
Yeah, thank you.
Okay, they are asking that signs be left outside, and people are complying with these signs there. I just got a warning on my phone that my storage is almost full. I didn't think that was a factor when I was doing Facebook Live, but I'll find out if it starts to shut me down. I'll have to go clear out some of what I've got on this phone and get back online. So just giving you a heads up that I may get disrupted. I think that's the that's the congressman over in another room next to this. So he's getting ready to come out here.
Taking cover. Yes. Yeah, I wasn't sure what the format was in here, so this is where he's going to meet with us, and we're just standing, and how are they going to...
It appears that way.
Have you been told anything about the questions and how they're going to approach the finalists?
Yep.
Okay, who's coming out now?
Again, I'm Richard O'Brien, I'm Mayor of Riverbank. I want to welcome all of you, those that are outside. Welcome to the great city of action. Today we have Congressman Jeff Denham here for a nice social. Congressman Denham has been a true friend of the city. He has worked very hard in trying to do the conveyance at the ammunition plant. In July, we'll be having a signing ceremony. All of you are welcome there for that signing ceremony. He has helped us in a lot of projects with Caltrans along 108, helping with just sidewalks as well as trying to get some safety issues out of the way. He's accessible to the city. He comes and visits us often. And he did address us at my state of the city, Riverbank State of the City. And as you all know, that he will be willing to talk to all of you. And sir, it's up to you. However you want to handle it. This is supposed to be a call.
All right, thanks, Mayor. Yeah, obviously this is different than our normal coffees that we normally do here, but first of all, let me thank the mayor and the council for inviting me back. We had a great State of the City a couple months ago where we talked about some of the issues here in Riverbank. We're working together to get the ammo depot transferred so that we can have some economic development here. But specifically, we've been addressing some of the safety concerns that we have right here in the community with expanding sidewalks, expanding some of the access to roadways. And that's the primary reason we do these coffees, is to hear specifically from individuals in the community, to understand some of the uniqueness of each different city, each different county, and some of the challenges that we have with safety and with access. I just appreciate you inviting me back again. So we do have coffee and snacks over here. I'd welcome you to do that. Again, this is a very, very informal process for me to get a chance to talk to the folks of Riverbank, but I'm happy to talk to anybody, no matter where you're from, in the district, out of the district, outside of Riverbank. I'm here to answer questions, but certainly we'd like to address these local issues first.
All right, thank you. Go on up and say hi to him, shake his hand, and talk with him. That's the way we do it here.
I have just one question. We really need all these costs are going up, out in our local ER. This is cost how in the world is this hospital going to survive with all of that?
So I couldn't hear. So tell me the first part of your question again.
If we decrease Medi-Cal funding the way it is being discussed at this point, people lose their insurance, they get sick, they show up in our local district hospital ER, the hospital has to absorb all of those costs. How is our hospital going to survive?
Sure. So as I've said many times in the past, we had challenges before the Affordable Care Act. The Affordable Care Act did address some of those things, not only the pre-existing condition, but also making sure that people that are added to Medicaid or Medi-Cal in California actually have coverage. Our challenge here is an access issue that we've got to continue to address. We had huge lines in our emergency rooms before the Affordable Care Act. They're even bigger now. I would say the one.
That's a lie.
So the large waiting in all of our emergency rooms now, and I've met with every single hospital now, at least they're getting some reimbursement now. So our challenge will be to make sure that doctors are actually getting reimbursed at a fair rate. California, the most prosperous state in the country, is 48th out of 50th when it comes to reimbursement. And while we just passed the tobacco tax, Prop 56, the governor's proposing, rather than reimburse doctors for taking Medi-Cal patients, he's proposing to take $1.2 billion and transferring that to the general fund. We need to make sure that the state has a commitment to this as well, that we're all focused on access to care and actually making sure that we're addressing our population here and our neediest are actually getting coverage.
How exactly does access doesn't mean that people can't afford?
I am Nora Jansen. I taught in this community in Riverbank High for 27 years. So you probably recognize me because I have been emailing you and calling you repeatedly.
Thank you for
Many
that.
of my students in this community are on Medi-Cal, are on some type of ACA coverage. I have students with diabetes. I had students with epilepsy, pre-existing conditions. We're not addressing the high cost of our medical insurance companies. Nothing has been mentioned in your bill that addresses the costs. It's all down to what is Medi-Cal going to cover? We have a lot of poor in this country. We do not need to give the rich more tax cuts. We need to address my
Thank you. I would agree. We need to address.
Why did you co-op it?
Let him speak. Let him answer.
Why do you change your mind?
Yeah, why you lying?
Why do you lie?
So I would agree.
How specifically does that amendment?
Ma'am, and I would ask everybody at the coffee to be respectful as our normal coffees are.
Can you be respectful and both ways?
Okay, well, this lady from Riverbank had a question. I'm glad to see you again. I'm glad that you're sending letters to the other and writing us emails. I want to respond to all of those, but I expect to be respectful. So I want to answer every question you have. Well, this could be a very long hour of just yelling and screaming, or we could actually have a discussion.
Go ahead.
I'm respectful. I'm waiting.
Thank you. So I agree, and we're going to be dealing with S-chip coming up. It expires. I think we've got to bring that up before June, which is where we're going to address a lot of the children's issues. But in this community, we have created more insurance through Medi-Cal. I think we've added about 85,000 people to Medi-Cal over the last 7 years, which is something that we've got to continue to do.
How about the cost? You didn't address in any of my emails or anything the cost. We're not addressing the insurance CEOs earning $55 million when my children need coverage.
Exactly. Or looked at the office budget to see what they had to say before you started voting on it.
So to answer your question, I would agree that under the Affordable Care Act, they have gotten rich. There's a reason that the insurance companies are all against this current bill. We've got to continue to lower cost across the board, and that includes not only the insurance companies, but the pharmaceutical industry, that we need to be able to have a low-cost access to our pharmaceuticals that so many of our seniors need.
But where in the bill does it address that? I see nothing in the bill. I've read everything, and there's nothing in the bill that addresses those concerns. You co-authored it.
No, ma'am, I didn't co-author the bill. The 117 pages I read as well. I also read the amendments, and we'll have other bills that are coming out to address this. Look, we didn't pass a huge package of bills and jam it through all at once. We're going to have to deal with several different bills and amendments through the entire process, but it's going to be very transparent and something that I'm going to continue to bring back to my community so that I can address it from a community perspective.
Can you help me?
Thank you. Yes, ma'am.
Yes, I was reading in the B, and they said that this bill would cause 60,000 plus to be kicked off of health insurance, and it also said that 7,000 jobs would be lost in our district.
Yes.
How could you vote for a bill that's going to cut 7,000 jobs and kick people off of health care?
I think there's certainly a lot of false information out there. The question that had come up very early on was, if you repeal the Affordable Care Act, we're going to lose a lot of people that are on Medi-Cal, and we're going to lose a lot of jobs in our community. We didn't just repeal them. We repealed and replaced, which was always a plan, to address all aspects of healthcare. We've got a long way to go. Yes, ma'am. I'm going to be respectful to you. Go ahead. Finish your question.
Rather than repealing, why couldn't you fix it? Why couldn't you? There are good things in Obamacare, in the ACA.
Absolutely.
Why couldn't you fix it? Why did you have to cause this havoc in our country? Scaring people, threatening. I mean, this is frightening for people.
It is frightening. Absolutely. You know, you're dealing with people's lives and people's health care, and we need to make sure that we get it right. And again, I've said many times there were some good things that happened out of the Affordable Care Act, but there were also some challenges that we've got to work together as Republicans and Democrats to fix. And pre-existing conditions was one of those things that I stood strong to make sure that we address those in this bill. We've got to continue to work on other areas that
I'm a
will address.
walking whatever.
Existing.
Existing conditions. I'm female. What are you doing for us? That's more than half the population. And you guys are just
Taken away
treating
family
us like
planning,
trash.
C-section
Second class
is now a
citizens.
pre-existing
This is
condition
not okay.
in the bill.
Thank you.
Yep. That's
Hi,
all great.
Darlene Patrick. I'm a constituent
No,
from
it's
Riverbank.
not.
First of all, I want to thank you for your service. I'm also a veteran. I was in the U.S. Army. So I'm a veteran. I'm 55, and I have a pre-existing condition. And your vote last week does nothing for me. In fact, your own party agrees with me because they're starting from scratch. Why would you put yourself on the line and vote for a bill that your own party can't even back? And it does nothing for vets, vets with pre-existing conditions, does nothing for someone who's 55. My premiums are going to skyrocket, or they will be allowed to.
Why?
So-
Why will they skyrocket?
Because of my age, 5 times. My premium can go 5 times what I'm paying right now if this passes. And for you to put yourself on the line and vote for something like that, that your own party in the Senate is saying, no, we're going to start from scratch. I don't understand that. I would like for you to explain that to me.
Sure. I vote on bills that I feel are the right thing for my community, and I've got the opportunity. Yes, ma'am. Yes, ma'am. So, and I will lead by example. I'm somebody that goes out there, finds out, has meetings in my community. We have a lot of coffees. We have a lot of meetings with doctors, with hospitals, as well as with health plans to figure out why the challenges of the valley are different from the rest of the state, and why the state of California is different from the rest of the country. So again, part of the challenge that I've been focusing on is access to care, making sure reimbursement rates are high enough so our doctors will actually see our patients, and that rather than having GME funds, funds that come from the federal government for residencies, rather than block granting those to a state that sends a lot of those residencies, the majority of those residencies, to LA and San Francisco and our coastal communities, to actually getting residencies here and a medical school here, so that we actually have doctors that are in our community.
That's a separate issue from health care for people. That's right. That's a totally separate issue, and you keep going with that.
We struggle with some of those matters. And I noticed this year.
Thank you. Same thing? Thank you. Well, as we look at our tax plan across the country, under the previous administration, the Obama administration talked about moving from 35% to 25% for our large corporations. And I've always felt that it's important with 85% of our businesses, small businesses, that we should lower the tax rate for everybody so we can actually create more jobs in our community. So,
Well, it's allowed me to hire more people in my business.
Corporations don't pay any tax, that's the problem.
It's looking a little promising because we are going to be able to hire more because of the tax breaks that we're going to get. So I wanted to thank you for that. But
And they're also part of the Riverbank Chamber and
very,
very good community leaders.
thank you.
Could not make out what
How you
those
doing?
questions were.
Me?
Yeah.
I have a question.
Sure.
During the town hall, you specifically said that you were not going to
Yes.
repeal and replace the Affordable Care Act.
Right. As it was currently written.
Now we come here and we get a message from a lot of people from Washington last week saying that you co-authored an amendment to a bill,
Yes.
and then you're going to now support that repeal and replace bill.
Yes.
Why did you lie to us, and why did you lie to me and my place of worship in the Assyrian Church of the East? Why would you do that?
Well, let's be honest about what I said and be honest about the entire situation. Actually, what I said was I cannot support a bill that does not address pre-existing conditions.
So why are people here complaining?
Let me finish.
High-risk pools are a disaster.
So under the current plan, a state would have to opt out. They'd have to apply to the federal government to do that, and they'd have to actually make sure that they had a risk pool available. So under the Affordable Care Act, President Obama put $4 billion for these high-risk pools. We doubled that to $8 billion in our amendment to make sure that even though
It's not $4 billion, it's
Let me
$200
finish.
billion.
Let me finish.
You're lying.
Again, we could debate this all you want. I can get you the facts. If you give me your email address, I'll send you the exact facts of what's happened under the Affordable
You already
Care Act.
have. I
On
don't
what
agree
the
with your
changes are.
facts.
Well, okay. Thank you. I appreciate your question.
So you're okay with waivers?
So you're okay with just taking people off insurance? Is that what you're saying?
How you doing? Go ahead.
Hi, Jeff. Thanks for coming out here. I know this can be difficult, but I'm going to scoot back here a little bit. I've got some questions. I was a fireman, worked fire and ambulance for 10 years, injured my spine off the job. So I have a pre-existing condition. And the only reason that I'm okay right now is because she works really hard, great career. But my concern is that Washington is sacrificing a safety net for the poor and the middle class for the gain of the wealthy. And that's where we're at.
So how do you think that they're sacrificing the safety net?
Well, they're giving the 1%, what was it, 750 billion tax cut for, and then as a pre-existing, if I lose her, what am I going to do?
So do you think California is ever going to opt out? Do you have concerns that Jerry Brown would try
It
to opt
doesn't matter.
out?
No, I'm not worried about
It matters. Because I look at every vote from a state perspective and a valley perspective, and part of my concern is California.
I'm fine. My wife has got me covered, but I'm worried about the poor and the middle class across the country. This isn't a California issue. This is a middle class nation issue. That's what I worry about. I don't care about just California. I care about Mississippi, Alabama. Like anybody who doesn't vote blue, it doesn't matter. It's an American issue. That's it.
No, I appreciate it. Thank you.
Thank you for
We
coming.
need to move to another state.
Mr. Denham,
So let me finish.
46 years.
So, I would agree that it is a national problem and it needs to be addressed from a national perspective. And I've had conversations with some of my colleagues from other states. Again, I vote my district, I vote my conscience, I take a look at California as a whole, and you know, some of our discussion with other California members has been about California. Would California ever opt out? And what if somebody, let's take a worst case scenario, sir, I'll give you an opportunity to ask a question. I'll give you an opportunity to ask a question, but let's be respectful. He's asked a question, he's waited.
Respectful, Jeff. I'm sorry, you're not respectful.
Respect his time. Can you respect his time? Thank you. That's very nice of you.
Thank you.
So that has been part of the question is what happens to Iowa? Some of my colleagues to Iowa said their concern was they've lost all of their insurance companies and have very little, if no, access to care. And so I've looked at it from a national perspective, but it all came back down to me from a California perspective. Will California go to a single-payer system or universal health care? And will the governor fund some of our access to health care problems? The other,
Leave him alone.
Leave him alone.
Leave him alone.
He's the one, get him away from me.
He's a troublemaker. We're harassing him.
Leave him alone.
I understand how personal.
I respectfully request that.
Are you going to repeal and replace the Congressional Health Plan?
Yeah, there you go.
Good for the gander.
Yes.
Your health. Are you going to follow AHCA for the Congress, or are you guys going to have a special plan?
I don't believe that Congress is going to have a special plan. I've never been on it. I don't take it. I didn't take it in the state. I didn't take it in the federal government. I've always done my own.
That plan is wonderful. I would kill for it.
Martin McSally had an amendment that forced members of Congress, which I supported, to be under the same health care plan as everybody else.
So the answer is yes, you're in favor of repeal and replace for Congress.
Yes.
Okay, thank you. Did you flip flop on that?
I appreciate your concern. Yeah. When bills change, when amendments get added, you would expect me to vote my community still, right?
That amendment doesn't cover us.
But it didn't change anything.
You just said you wanted the congressional health plan to be the same as everybody else across the country.
Yes, sir.
So that's what the Martha McSally amendment did. I supported it. We voted on it, bipartisan, Republicans and Democrats. But as far as my personal health care, I've always had it been on my own plan.
Lucky you can afford it.
Lucky you.
I have the same question, but also I understand there's a bill in Congress to allow Medicare to negotiate with insurance companies, with pharmaceutical companies to lower the prices. My husband can get a medication from Canada, the same brand name, for 25% of what it costs in the United States. Are you in favor of allowing Medicare to negotiate with pharmaceutical companies
And technology companies.
I am in favor of using our buying power, whether that's Medicare or the VA or any of our government agencies, using our buying power to lower overall prices.
So you would vote for that?
I would have to look at the bill. Again, I don't commit to things until I see what the final version of the bill is and what the amendments are.
Can I just clarify, you read the entire bill before you voted on it?
Yes.
You did. You're
Yeah.
the one congressman that we know of who read the entire bill before you
I don't know
voted.
if that's true. It was read in committee. It was read a couple of times.
Really?
Yeah. Bipartisan, both parties working together, yeah.
So not every Democrat voted for it. There's not one Democrat that voted for it.
I've lived here since I was 6 years old. I've lived in this valley. I live 4 miles away. Modesto address, Riverbank phone, Oakdale Utilities. Pick a town. I'm your constituent. I'm at your office every week. I call you. I email you. I write you letters. You've sent me one email in response. My roommate has MS. She's in a wheelchair 90% of the time. She's on Social Security and Medicare. She's now screwed. I have fibromyalgia, arthritis, degenerative discs, plantar fasciitis, in addition to a really bad attitude right now because my Medi-Cal's getting me. I am suffering, and you don't care. I have talked to you, I have been polite, I have been civil, and I get blank blah, blah, blah in response. You don't hear me. You're not representing me. I'm suffering and you don't seem to hear it or care because somebody with a hell of a lot of money has got you in their back pocket. What can you do to help me? Me and my friends, my poor friends that are sick.
Sure, nobody with a hell of a lot of money has me in their back pocket. I vote my conscience. And I know the Democrat Party has organized this morning, and they normally spend.
Not even close.
Since November, I've been visiting your office.
Where does your unhappy constituents?
I know there are some unhappy
This is
people
a
here.
human rights issue, not
Sure.
a political
Well,
issue.
the press that's here will pass out the same information that everybody else got here, but look,
This bill doesn't help me.
I
This
go
bill
to all the
screws me.
political events as well, and the Democrat Party is going to continue to organize these. I'll continue to answer all questions.
This was organized by grassroots activists, by
This
the way.
is local residents here.
Local residents.
I understand there are some local residents here.
All local residents.
The big corporations and the big companies
You're not on my
spend tens
side.
of millions of dollars against me in Nancy Pelosi's direction every single election.
Throw that in. You're not on my side.
That's
What
not
can I
us.
do to make
So
you
what
see
I would
that?
ask you to do, if your Medi-Cal has been cut, please give us what I deal with is facts. And if you bring in your
Well,
information,
It hasn't passed yet.
also it hasn't been cut yet. It hasn't been cut yet?
What you voted on will cut my Medi-Cal if it passes. And
We
you
don't
know it
believe
will.
that's the case.
Because I live in California, we ought to go to single parent. We need to go to single parent. The whole nation.
Why
needs
is
to go
Jerry
to
Brown
single
against
parent.
that? I don't understand.
I don't know what Jerry Brown.
Are you against it?
We're not talking about Jerry Brown. We're talking about
Well, you said single
You
parent. Yes, that's
voted
a.
against me. You voted against me. You voted against.
I voted for something that I felt would help my district.
How? Exactly how?
So if your Medi-Cal gets cut, I would ask you to bring it in so that we can deal with the facts and we can help you out. That's what we do.
I'm asking you, how is your vote going to help me? You tell me how it will help me. They'll all listen because I want to hear it.
Because you read the bill.
If you have Medi-Cal, you'll continue to be on Medi-Cal. If you have a pre-existing condition, you'll continue to have pre-existing coverage.
With what money? Yes, how much?
My friend on Medicare with the wheelchair. How are you gonna help her? This isn't helping anybody, and you know it. The poor people are screwed. The middle class.
How?
people
How are they screwed?
You cut the funding.
Your bill that
You're
voted
telling
for
me that it's
on
cutting
Wednesday.
Medi-Cal but can't tell me where.
Because
You're
it
telling me
wasn't
she's not going to be
passed
able to be covered under a pre-existing condition but can't tell me why.
You capped the
Because
funding.
there's an increased cost in funding.
Yes, with pre-existing conditions, once there's pre-existing conditions, in that bill, it says that there's going to have to be higher payments to the insurance companies in order to be covered.
If you do not
You
have
said that
continuous
you had read
coverage,
that,
if you drop your coverage,
which happens all the time because people change jobs, people lose jobs, things like that, and the that's
this
the
has
poor that we're
portability
talking
with it so
about.
that you can keep your insurance and take it with you.
At those higher prices. And who can afford at those higher prices? I'm a nurse in this community. I am a nurse practitioner in this community. I also am a nurse educator in this community. And we have talked to you, so I guess I'm trying to understand how when nurses are telling you to vote against this, when physicians, even though you're saying that that's who you're trying to support, tell you to vote against this, you as a farmer are not listening to the people that are caring for these patients. And so I don't understand how you can do that vote with a clear conscience when you don't understand. I wouldn't pretend to understand farming because that's not my specialty area. And so I would listen to what you have to say. So what I would like to know is how come you're not listening to what we have to say? The Affordable Care Act, yes, it does have holes, but it has made huge differences that I have seen in my career, and I've been a nurse for 25 years. And what we have seen that has changed is we're focusing on preventative care, which this bill now wants to cut. We were helping more with research to help new technologies to make care safer and of higher quality. We were holding hospitals accountable for higher quality. All those things are changing, and the pre-existing conditions, all of those are actually worsening. And so how are you going to support your patients within your valley? And that's what I don't understand. How are you not listening to the people who are actually caring for these people?
I am listening, and that's not just all of the teletown halls or the town halls or the mobile district office hours or even the community meetings that we hold in our offices. We do those all the time, but under this important debate, I've gone out to the hospitals. I've gone out and talked to the nurses. I've gone out and actually asked the questions on how do you fix our overcrowded emergency rooms? How do you get doctors to actually take Medi-Cal patients? How do we get residencies in our all of our health clinics that right now today have doubled in the amount of payments from the federal government? They receive about 80% of their funding to address the needy in our community, but still can't get residencies. So there are a lot of challenges that not only have I listened, but I'm fighting to make sure that we actually have a good response in this bill.
Which one of those local professionals thinks this fixes that?
Was actually supporting increased education of physicians coverage and also nurses. It was actually covering that increased education so that we could get more providers. Yes, we were behind the gun because we had increased access, but it was actually covering those things. So in that, by changing that, you're not improving it. We were actually that way. And by cutting public health funds on top of it, we're going to increase, we're already seeing increased rates of syphilis because we keep dropping those kinds of public health conditions, public health education. So every time we're cutting things, we're actually worsening the health of our nation.
Yes.
Health of our nation, health of our economy.
Under the last 8 years, it's been getting worse.
After the last 3, it's actually been getting better. Before that, when you look at the numbers, so I mean, if you need to read facts, if you need to read research, I can provide that to you.
I would love that. Yeah, thank you.
But I can tell you that things have, we were not looking at health outcomes. For a long time, we've been looking at patient satisfaction, but we haven't been looking at outcomes. And actually, outcomes are starting to improve. We're actually starting to change some of those things under the Affordable Care Act. And so I do not see at all when I read your bill, because I also teach a health policy course right now. And so when I look at this present bill, it is making conditions worse. It is not actually supporting any of the positive movements that we've seen in these last 3 years. And it's hard to see in full fruition what the ACA is doing because it takes time for change to occur, for outcomes to occur. So when you guys are repealing and replacing something that you don't even see fully the benefits of, but obviously your constituents do, because they're fighting against it. So, you know, they see the promise, they see the benefits just as I've seen the benefits in these last 3 years. You know, things that, like prevention, that is so important and actually has been shown in research to decrease the cost of overall chronic conditions. And so, you know, those are the kinds of things that we want to continue to move on and benefit from. And so I would ask you to really listen to your constituents that work in these fields and support that, just as I would want to support what you know.
Thank you. I appreciate it. And it sounds like you know a lot about this and you're willing to share facts. I would encourage you to do so. Let's have an ongoing dialogue. I've been trying to find more and more resources in my community because, yes, this is a national debate, and certainly it affects the entire state, but I've always believed that California's Central Valley is different than LA and San Francisco, and we have some unique needs. So let's talk about fact-based outcome of where we're at today and where we're going, and let's continue to have a dialogue about not only the bill that just passed the House, but what may or may not happen in the Senate.
Definitely.
We need a lot of work.
I will be more than happy to.
Thank you.
Thank you.
Before I pick on any more hands, anybody that has a local issue in Riverbank outside of healthcare? Mayor?
I do. Yes, sir. Patterson Road, along BNSF, is a safety hazard. And we're trying to work with BNSF to get an easement permit to widen the road to 55 feet so it'd be safe for the kids. If some of you came down Patterson Road this morning, saw the kids walking across the street. To me, that is a safety hazard for the children. And they walk along the railroad tracks because that's an easy way to get up and down, north and south. So is there someone I can talk to in your office to get going with BNSF?
Absolutely, yeah. Let's, which part of on Patterson Road?
From First Street to Claus Road, going right up to the high school.
That's where the church is?
No,
the
that's
church
one
goes
way.
over this way. It's when you cut off of Patterson Road and go this way, behind downtown to the south.
It's
southeast
3
of
blocks
downtown.
Okay. Yeah, definitely we'll work on it. I noticed this morning as we drove over that a very, very busy street, watching kids cross over the railroad tracks with no gate crossings, and there was a train coming by very quickly, and does create some challenges. So yeah, let us work on expanding that for safety purposes. Thank you.
Thank you, sir.
Thank you.
Jeff, you never let me ask.
Yes, ma'am.
You recently, according to my information, the wealthy were given an $889 billion tax cut. According to my research, it costs $192 billion to really give people the pre-existing condition situation. You're giving tax credits to pay premiums that are based on age, not income, and they max out at $4,000, which is a lot less than the Affordable Care Act. That means the oldest people that are under 65 can be charged 5 times more than the younger people. How are you rectifying this when there just isn't enough money in this tax credit to really help the elderly? And I don't understand why you give a big tax break to the wealthy, and then we need $192 billion to pay for pre-existing conditions, and you only voted for $8 billion to give to the states, which really is still a decision by states to decide how they're going to handle pre-existing conditions. It's still very individual to what they decide who's going to get that kind of care.
Sure. Thank you. So the amendment that was passed at the final day of before the vote came, raised it from $4 billion under the Affordable Care Act to $8 billion. Under looking at that high-risk pool, the $4 billion that President Obama had put in there, only about $1.5 billion was actually being used. So we doubled that just to make sure, because there are some changes in here. But I'm sure that this will be something that we go back and address if we see that pool rising beyond the $1.5 billion that was already in there. We also addressed the Thune Amendment in the Senate, which we expect to come up. We made the ability in the bill itself to be able to address the neediest in the community, to make sure that it is need-based as well.
Now, am I understanding it clearly that this is going to be a decision for pre-existing conditions, that it'll be a state decision? They will have power to decide who's going to opt in and who isn't going to get it? Because that's the way the media is presenting it, and in what I have read, they're presenting it in that fashion.
Sure. There are states that may try to apply for the waiver. They'll have to go back through the federal government to do that. We expect that to be a very difficult process, but if they go through the waiver and they get exempted out, then you will have the high-risk pool enacted. They have to prove to the federal government that all pre-existing conditions will be covered. It's something I don't expect California to ever do. In fact, California, we're still seeing the proposal of universal health care.
The waiver shouldn't be an option.
Do you have experience actually dealing with buying insurance through a high-risk pool? Because I tried to for my husband. It would have cost us more than our income every month to only insure him. There was a 6-month waiting list about that, depending on how fast people died, to get onto the insurance. Once you got into the California high-risk pool, there was 6 months you had to pay premiums before it covered your pre-existing condition.
This was in California?
This was the California high-risk pool. My husband's employer canceled our insurance without letting us know, gave us our COBRA packets on day 62, and let us know we could pay all of our premiums for the last 2 months. We didn't know because his meds get filled every 3 months. So we didn't know we didn't have insurance for the first 60 days. And yeah, I know it's illegal, but it doesn't mean people don't do it. Okay? So then when we applied for the California high-risk pool for my husband alone, it would have cost us our entire income, $2,000 every month. Wow. Except there was a waiting period before we were allowed to buy. And then it was 6 months before it would cover his medication that keeps him alive. So how are we supposed to be assured that people in other states, because yes, California won't apply for waivers, but people in other states need to be protected from that too. That's unacceptable.
I'd love for you to help me to understand it better. If you can
I've tried. I've emailed your office several times. I have gotten back form letters that do not address a single point.
Well,
exactly. It's very frustrating.
Agreed.
I have experience trying to buy insurance on the open market before the ACA. I have experience trying to buy insurance on the open market after the ACA. I have experience trying to get my husband into the high-risk pool. I have experience billing insurance both before the ACA and afterwards. I have insurance being a patient advocate in the billing process. I have concerns about insurance policies from states that apply for waivers for the essential benefits. I have plenty of clients. I bill for maternity care. I have plenty of clients before the ACA whose employer specifically did not cover maternity coverage. That's ridiculous. I have been knowledgeable about my own health insurance for my whole life. This is the first time with the ACA and the essential benefits coverage that any of my insurance plans have ever covered mental health services. I don't understand that. I don't understand how that can be excluded. Here in California, we're required to cover addiction services, but before the ACA, we weren't required, did not require employers to cover mental health services. Having people buy plans out of state means that the insurance commissioner of that state makes the final determination when they have an argument with their insurance company about coverage. It means that insurance billers like me will have to learn the laws from each and every one of those states and hope that some other state's elected officials are going to defend our clients. No part of this is okay. No part of it helps defend Americans, Californians specifically.
Well, I would love to have you come in and walk me through the process that you've gone through. You've got an open invitation.
I email you all the time.
Yes, but let's set up a meeting.
I get back form letters saying
But now
that
I'm
you're
here.
doing the
Let's
best.
set up a meeting.
You should have done that before
What's
you
your
voted.
name?
My name is Brooke.
Exactly.
Yes. Yeah, I'll email you. I'll give you a call.
We'll get her information.
I have really serious concerns on all fronts
let's sit
about
down.
the AHCA, about how it's not going to help your constituents.
Perfect. Let's sit down and talk about it.
I haven't been invited in.
I'm inviting you in. I'm inviting you in right now. Let's get your information. Let's set up a meeting. Bring your information in. Let's walk through it. Help me to understand.
You should have done that before you voted.
I've offered in many instances to help you understand my concerns.
Perfect. Come on in. I would love to. Thank you for the opportunity.
It's 484-2444.
2444. And then click on the and help her set that up with you.
Thank you.
And if you can bring any information in on just to help walk me through this, that would be helpful as well.
Information.
Like your insurance paper.
How it went through with Cobra, what you went through with.
I don't have the list of denials from insurance companies from 10 years ago. No,
Anything
I don't
you
have
ha-
that.
Anything you still
So this
have.
happened before the Affordable Care Act?
Before the Affordable Care Act, we were turned down to buy insurance on the individual market. Yes.
Okay.
By every insurance plan that didn't want to take our money. Because my husband at the time was type 2 diabetic.
Okay.
Okay? We were then tried to apply for California's high-risk pool, in which case we were told there was a 6-month waiting period once you got on the insurance. The waiting list to get onto the insurance was about 6 months, and it was going to cost us more than our income. Just to insure one person in our family. We spent about 20% of our income on his meds to keep him alive. And we did. We kept him alive. But we were too rich to put him onto Medi-Cal or any state aid plan. The expansion of Medi-Cal here in our state would have helped him if it was then, but it wasn't.
So he's not on Medi-Cal now.
He's not on Medi-Cal now. He has a job that provides us with insurance benefits, but we pay about 8% of his income for our insurance, and I'm happy to do that. Actually, I wish we just had a 10% increase in our federal taxes, and then we had some universal health care, because 10% of our income, if it goes to premiums, it goes to premiums. If we are paying for a low premium insurance, we're paying 10% of our health care just to get the health care. And that's the experience of many of our clients in my work as well. So either you pay a lot for full coverage insurance, or you're paying a lot out of pocket and hoping against hope you don't get in a car accident and lose your house.
Well, I mean, this is certainly a debate on universal health care that I would love to have with the governor and the administration, but his numbers show that it's way above 10% what the new taxes would be for overall California. That's why he said he's opposed to it, but I'm looking forward to the full debate on that. My specific question for you is, if we're going to contact you, we'll set up the meeting. but any information you can bring in that helps us to walk through this, to understand the challenges that you've gone through, will help us to understand this for others. So even though your situation may be covered now with your new insurance, thank God your husband's got a job now, but
He had to commute 6 hours a day every single day of the week in order to be fully employed with insurance for 5 years.
huh,
That's what it takes if you live in the valley.
it does. We're trying to work on transportation too, but
Okay, perfect.
thank you. I want to sit down and have a dialogue about it.
I'm glad you do.
It would be helpful. Yes, sir.
I just wanted you to know that I feel pretty stupid that I called the day before encouraging you not to vote no, and your office told me that you were voting no. And then less than 24 hours, I saw on the screen that you voted yes. And so I called back to let you know that I was really upset. And the guy that actually was going to take my message tried to debate me on the policy about it instead of actually just taking the message. So I just wanted to let you know that the whole experience really made me feel about this big. And I feel like that is a dishonest thing to call the office, say that you're voting no, and in less than 24 hours, I see that you voted yes.
Well, I apologize for your experience. We expect to work with anybody that calls our office or emails us or sends us a letter, that you actually not only get a timely response, but it is a very, very respectful response. So,
Not one of us has had that experience.
but when it comes to my votes, sure, you know, when amendments come through and bills change, if it's the issue that I've been focusing on, like lack of access in the valley or pre-existing conditions, as I've said in my town halls or my mobile district office hours, many of the events like this, that I'm focused on making sure that pre-existing conditions are in the bill. So adding $8 billion to the risk pool was something that I was very, very focused on. Look, it's personal for me too. My father passed away with a pre-existing condition. So did my father-in-law. My mother-in-law just recently passed away with cancer. These are very not only personal issues, but they're emotional issues. The same way that they're emotional for you. Let's be respectful. Let's be respectful. This is my family you're talking about. If my family...
This is our freedom.
Have a little bit of compassion. I'm sharing a personal story with you about my family member that passed away with a pre-existing condition, and you're going to try to shout me down?
Did they have insurance? I'm a nurse now in Central Valley with a pre-existing condition, and the medication I take now costs me $600. I mean,
I understand.
a month.
But I'm sharing
if I
with
did
you
not have
I'm sharing
insurance
with
through
you
the
that my father
Affordable Care
passed
Act,
away. No, he didn't have insurance. He was
I
on
would not
hospice.
be able to afford my medication.
Hospice is paid for by
That's
insurance. Yeah.
Hospice is good. So you're talking about us
I'm talking
and
about a
our
personal
business, too.
situation with my father passing away.
We're talking about
And you're trying to shout me down.
Me too.
We're talking about personal situations too.
Right over
Yes, sir.
First of all, I'm a registered Democrat. Get that shot. But the thing I'm concerned about of all this is everybody wants everything. And with Obamacare, first of all, it didn't come out, as Nancy Pelosi said, once it's passed, now we'll look at it and see what's in it. So there wasn't the discussion we're even having here. Second thing is, from the time up until Obama, the national debt was $10 trillion. After Obama, it was $18 trillion. So in those 8 years, we have this big national debt. The thing I'm concerned about is that I share a lot of the same comments that the people here have, but I'm afraid for our country. How are we going to finance all this stuff? If Obamacare went up $8 trillion in just those few years, pardon me? I couldn't understand what you're saying.
Talk about the wars.
War's expensive.
Afghanistan and Iran.
You're saying Obama took us into more wars and spent a lot more money.
It doesn't matter. The highest other.
Two of my sons to Iraq and one to Afghanistan.
Excuse me. The highest it had ever been through all the other wars with Bushes and all these other people, Bushes and Clintons and so on, was $1 trillion. This is up $8 trillion. Now, it doesn't matter about whether there's wars or this stuff. How are we going to finance all this stuff? We're about a broke country. We talk about Greece, we talk about Spain, we talk about Puerto Rico, Venezuela. all having problems, but our national debt's just climbing through the roof. And I don't know how healthcare is part of it, the other things are part of it, maybe the tax thing isn't right. I don't know all these answers, but I'm scared that sooner or later, we're gonna see that we are bankrupt. How can we go up another $8 billion in the next 4 to 8 years?
I know how.
Tax the rich.
We can tax the wealthy.
Okay, but I'm not advocating for any of this stuff, but look at it. The numbers have come out that 35% of the taxes paid are by the 1% wealthy. Okay, in California, 50% of the people pay no taxes. Okay, now I don't pay a whole lot of taxes, but the thing I would do is say that everybody should pay a little something in taxes. And yes, I don't like the corporations making off of this and that and going to other countries and all this other sort of stuff. That's not for me either. But I think that we're always saying, get after the rich, get after the rich. I'm certainly not rich, living on a little bit of Social Security. But on the other hand, they are paying a big chunk of it. And 50% of the people are paying nothing. So why don't we all pay $5 and chip into it? My point is I'm not arguing with any of the people out here about the health care. My son got butchered when we went to Obamacare because he was young and he was healthy and he was this and that, doesn't use any health care, and he had to pay a big premium. Okay, that's fine, that's the way it is. But I am concerned that as a nation, how are we going to pay for all this stuff? That's it. That's it.
We have 1 minute. The rich.
Thank you. I appreciate your comment, your concern. I have the same concern. You know, we went from $8 trillion over 19 trillion now to over $20 trillion. At a certain point, you know, our economy does get overstressed, and I believe we're at that point right now. There are things that we've got to do to bring companies back to make sure that we're creating more jobs, that we're boosting our economy, and that we're actually a net exporter instead of a net importer of products. And I think one of the things that we're going to get to is this infrastructure bill, which the biggest part of the infrastructure bill for me is water storage. If we can build Shasta higher, if we can build sites, Temperance Flat. Yesterday we were touring where we have some off-stream storage for flood protection, but that off-stream storage is also water that can be used and transferred so that we can have a vibrant agriculture economy. We've got to be looking at different ways, not only for the valley and for the state, but across the country. How do we get companies that are willing to invest in infrastructure here that will help us not only to create jobs, but to pay this debt down? We've got to eliminate the debt, and that's going to be a big part of this overall debate. As we talk about other priorities as a country, our health care, our cost of goods, minimum wage, you know, making sure that we're addressing a variety of different issues and priorities as we move forward. Thank you very much for your question and your comments. I'd like to thank everybody here for joining us at our coffee. If you didn't get coffee, there's still more coffee and stuff here. And those of you that did not get the flyer that shows my full schedule, we'll pass that out, and the media can have that as well. But I'd welcome you to engage us as we continue to have meetings throughout the district. Thank you very much. Mayor, thank you.
Probably close down here in a second. Just going to see what happens at this moment. Okay. Hey, thanks for watching. Going to sign off. We'll have this posted on Facebook.